42 million Americans woke up on November 1st, 2025 and discovered that their SNAP benefits had stopped, not reduced. Stopped. For the first time in the 60-year history of the Supplemental Nutrition Assistance Program, the United States government ceased distributing food assistance to 42 million people, including 16 million children, 8 million seniors, and 4 million non-elderly adults with disabilities. The American Friends Service Committee reported that the Trump administration chose to let SNAP run out during the government shutdown despite having a contingency fund with enough money to extend benefits through at least mid-November. They chose not to use it. The Women, Infants, and Children program, WIC, joined SNAP in ceasing benefits, cutting off 7 million mothers and children simultaneously. And the food banks that Americans were told to turn to instead did not have the capacity to absorb 42 million people showing up at once because no charitable organization on earth has the infrastructure to replace the largest food assistance program in the richest country in the world overnight. And that shutdown cut was temporary. It lasted weeks, not years. What is coming next is not temporary. It is structural. It is permanent in every practical sense, and it will hit the same 40 million Americans plus millions more through a series of interlocking cuts to food, healthcare, housing, and income that have already been signed into law and are already being implemented. George Washington University's Milken Institute School of Public Health published a state-by-state analysis showing that the combined Medicaid and SNAP cuts in the One Big Beautiful Bill Act will cause $1.1 trillion in lost critical programs and services over the next decade. $1 trillion in aid that currently keeps 40 million Americans fed, insured, housed, and alive, and the first wave arrives this year. Not next year, not in 2028, this year. And the 40 million Americans who depend on these programs have no idea what is about to happen to them because the legislation was 1,000 pages long, the implementation timelines were buried in committee reports, and nobody in a position of authority has told them in plain language what they are about to lose and when they are going to lose it. U.S. News reported that the provisions are staggered over several years for a myriad of reasons, including mitigating political blowback in the 2026 midterm election. The notification letters will arrive in October, right before the election. The terminations take effect after. The work requirements implementation deadline is December 31st. The most severe cuts begin in 2027 and 2028. The political calculation is visible in the calendar. The pain is scheduled to begin after the ballots are counted, and the 40 million Americans who will bear that pain do not know it yet because the bill was drafted to ensure they would not find out until it was too late to change the outcome at the ballot box. 1 million jobs will be destroyed in 2026 alone, and most of them will be in communities that cannot absorb the loss. The George Washington University analysis projected that approximately 1.03 million jobs will be destroyed nationwide in 2026 alone as a direct result of the Medicaid and SNAP cuts. That number is not a decade-long projection. That is 1 year. 2026. The year you are living in right now, and the breakdown of those job losses reveals why the damage will be concentrated in the communities least able to absorb it. 477,000 healthcare jobs will be eliminated. Hospitals, clinics, doctors' offices, pharmacies, and nursing homes will lose nearly 500,000 positions because the patients they treat are being removed from the Medicaid rolls. When patients lose coverage, they stop coming. When patients stop coming, the revenue disappears. When the revenue disappears, the staff is laid off. And in rural America, where the local hospital may be the largest employer in the county, the loss of Medicaid revenue does not just mean layoffs. It means the hospital closes permanently. And once a rural hospital closes, it does not reopen. The building is sold, the equipment is auctioned, the specialists relocate, and the community that depended on that hospital for emergency care, obstetric services, and chronic disease management is left with a 45-minute ambulance ride to the next nearest facility. That 45-minute delay is a death sentence for certain cardiac events, certain strokes, and certain trauma injuries where survival is measured in minutes, not hours. Another 411,000 jobs will be lost in other industries as the economic shock ripples outward. Retail, construction, manufacturing, food service, and transportation all lose positions because the workers who were employed at the hospitals and clinics were also the customers at the grocery stores, the renters in the apartments, the parents at the schools, and the tax base of the local government. When they lose their jobs, every business that depended on their spending loses revenue. and the Commonwealth Fund estimated that the total impact would be even larger when you include the 300,000 additional job losses from the expiration of ACA premium tax credits and the potential $500 billion in Medicare cuts triggered by sequestration. The combined total could exceed 1.3 million jobs lost in a single year, and the timing could not be worse. The labor market is already in what Stanford described as a low-hire, low-fire equilibrium. Average monthly employment growth has been just 17,000 since April 2025, a level that historically would signal a labor market in crisis. When 1.3 million jobs are subtracted from an economy that is already creating only 17,000 per month, the arithmetic produces a net negative that would push unemployment sharply higher in the states most affected. The GW analysis estimated that the total economic output lost would be $157 billion, even larger than the $113 billion reduction in state GDPs, because the multiplier effect amplifies every dollar of federal cuts into approximately $1.65 of total economic loss. A restaurant that serves the hospital workers who just lost their jobs closes. A daycare center that serves the nurses who got laid off loses enrollees. A gas station in a rural town where the clinic was the primary employer loses traffic. Each closure triggers another round of lost jobs, lost spending, and lost tax revenue. The state and local tax revenue lost from those job losses is estimated at $8.8 billion in 2026 alone, which means the states that are being asked to absorb higher SNAP administrative costs and build new Medicaid verification systems are simultaneously losing billions in tax revenue that they would have used to fund those obligations. The math is not just difficult, the math is impossible, and 49 out of 50 states are constitutionally required to balance their budgets, which means the revenue shortfall must be filled either by raising taxes or cutting other programs. In practice, states will cut education, infrastructure, public safety, and other services to cover the gap. The federal government is not just cutting food and health care for 40 million Americans, it is forcing state governments to cut everything else to pay for the federal cuts. The damage multiplies at every level of government it touches. SNAP participation has already dropped by 3.3 million people, and that was before the major cuts even started. The Food Research and Action Center published an analysis in April 2026 that documented something extraordinary. SNAP participation has already declined by approximately 3.3 million people over the past year. That decline happened before the major benefit cuts in the OBBBA took effect. FRAC described it as a deliberate policy design for decline in SNAP participation, driven by administrative barriers, chilling effects from immigration enforcement, removal of enrollment simplifications, and the government shutdown that cut benefits for weeks. And the decline is neither a neutral correction nor evidence that fewer Americans need help affording food. It is evidence that the system is being restructured to exclude people who are eligible but cannot navigate the increasingly hostile bureaucratic environment. 14% of U.S. households reported food insecurity between January and October 2025, according to Purdue University. That number was 12.5% in 2024. The trajectory is upward, and the cuts that are still coming will accelerate it dramatically. The OBBBA cuts $187 billion from SNAP through 2034, a 20% reduction in the program's funding. The Center on Budget and Policy Priorities documented that the law will affect all 40 million participants, including 1 in 5 children in the United States. Over time, SNAP benefits will become increasingly inadequate to afford a healthy diet because the law restricts future updates to the Thrifty Food Plan, which is the basis for calculating benefit levels. CBO estimates that the average SNAP household's benefit will be approximately $14 per month lower by 2034. That sounds small in isolation. It is not small when the starting benefit averages approximately $194 per month for an individual. A $14 reduction is a 7% cut to a benefit that was already insufficient to cover the cost of a nutritionally adequate diet in a country where grocery prices have increased 36% since 2014 and where coffee is up 19% year over year and beef is up 15%, according to Bureau of Labor Statistics data. And the expanded work requirements will cause more than 2 million people to lose access to SNAP in a typical month, according to CBO projections. Brookings confirmed that the first enrollment data reflecting these provisions should be published this year, and the farmers who grow the food that SNAP recipients purchase will also feel the cut. FRAC estimated that farmers stand to lose $24 billion over the next decade as household food purchases decline. Within 6 months of participants losing SNAP, small grocers could see sales decline by as much as 6.7%. Over 9 years, SNAP-related sales are projected to fall by an average of 8.7%. The SNAP program is not just a food program, it is the economic circulatory system of low-income America. When the blood stops flowing, every organ in the body suffers. The grocery store, the farm, the distribution company, the food processing plant, the truck driver who delivered the product, the county government that taxed the transaction. Every link in the chain loses revenue when SNAP recipients lose benefits. And the chain runs through every congressional district in America. And the government shutdown already demonstrated what happens when that chain breaks. When SNAP benefits stopped on November 1st, food banks across the country were overwhelmed within days. Feeding America, the largest hunger relief network in the United States, reported unprecedented demand. Churches, community centers, and volunteer organizations scrambled to distribute whatever they had. But the scale was impossible. A food bank that serves 500 families per week cannot serve 5,000. The volunteer infrastructure that supports charitable food distribution was built for supplemental relief, not for primary nutrition. It was designed to fill gaps, not to replace the entire federal food assistance system. And the people who showed up at those food banks were not strangers to the organizations. Many of them were the same people who had been donating to those food banks a year earlier before the cost of living crisis pushed them from donors to recipients. That transformation, from giver to taker, carries a psychological weight that compounds the material deprivation. The shame of standing in a food line when you spent your career donating to one is a kind of poverty that does not appear in any government statistic. And it is a kind of poverty that 40 million Americans are about to experience in varying degrees as the structural cuts to SNAP reduce their purchasing power below the threshold of nutritional adequacy in the most expensive food environment in American history. 22.3 million households will lose health care coverage that they cannot replace at any price they can afford. The Urban Institute projected that 22.3 million households will be affected by the Medicaid changes in the OBBBA. The Congressional Budget Office projects 10 million more Americans will be uninsured by 2034. 5 million will lose coverage from the healthcare changes taking effect in 2026 alone, according to Brookings. And the mechanism of the coverage loss is important because it reveals why the damage is irreversible for most of the people affected. The work requirements demand 80 hours per month of documented employment, community service, or educational enrollment. The exemptions are narrowly defined. Parents of children under 13 are exempt. People who meet the medically frail definition are exempt. But KFF documented that the medically frail definition requires verification, and many people with substance use disorders, physical or intellectual disabilities, or serious or complex medical conditions will struggle to provide the documentation required to prove their exemption. The person with chronic back pain who cannot hold a job but whose condition does not meet the strict documentation threshold will lose coverage. The person providing care for an aging parent who does not qualify under the narrowly defined caretaker exemption will lose coverage. The person working 30 hours per week in a gig economy job with unstable hours who cannot document a consistent 80-hour month will lose coverage. And when those people lose Medicaid, the law bars them from receiving subsidized ACA marketplace coverage. That provision is extraordinary in its cruelty. It creates a class of Americans who are too poor for unsubsidized marketplace coverage, too non-compliant for Medicaid, and too healthy for disability benefits. They exist in a coverage gap that the law itself created, and the only way out of that gap is to reapply for Medicaid from scratch, triggering a new compliance check, which takes weeks or months to process. During those weeks or months, the person is uninsured, and an uninsured American who gets sick, who falls, who has a cardiac event, who discovers a lump, who needs emergency surgery, will receive a bill that a person who was recently on Medicaid cannot pay. The average emergency room visit costs $2,200. The average hospitalization costs $14,000. The average heart attack treatment costs $50,000 to $100,000. A single medical event can destroy the financial stability of an uninsured household in a matter of hours. And the 22.3 million households that are about to lose coverage are the households least financially equipped to absorb that bill. They were on Medicaid because they could not afford private insurance. They cannot afford the bills that arrive when the Medicaid is taken away. Medical bankruptcy filings will surge, medical debt collections will surge, and the financial destruction of a medical bankruptcy follows a person for 7 to 10 years, destroying their credit score, their ability to rent an apartment, their ability to get a job in industries that check credit, and their ability to rebuild any form of financial stability. And the healthcare providers who serve these communities face their own destruction. The GW analysis found that fewer health professionals would be available to provide care after the 477,000 healthcare jobs are eliminated. Some health facilities, rural hospitals, pharmacies, and nursing homes will shutter entirely, limiting access even for those who remain insured. Hospitals and grocery stores will be forced to tighten budgets, which could mean layoffs and cuts to contracts with external vendors, amplifying the economic damage. The Medicaid cuts do not just take health care away from the poor. They take jobs away from the middle class. They take revenue away from businesses. They take tax revenue away from state governments, and they take access to emergency and routine medical care away from entire regions of the country where the local hospital or clinic was the only provider for 50 miles. Fierce Healthcare reported that when the Trump administration implemented a federal funding freeze at the start of 2026, community health centers struggled to access funding, and the move sent a shockwave through the system. That was a temporary freeze. What is coming is a permanent structural reduction of $863 billion in federal Medicaid funding over the next decade. The shockwave from the freeze will look like a ripple compared to the tsunami of the permanent cuts. The children will pay the highest price, and they did not vote for any of this. Nearly 40% of all SNAP participants are children. 16 million children depend on SNAP for food assistance. The Center on Budget and Policy Priorities estimated that approximately 1 million children will see food assistance to their families cut substantially or terminated under the expanded work requirements, the elimination of eligibility for many lawfully present immigrants, and other benefit cuts. New America documented that children under 5 are the group most likely to face eviction, due in part to unaffordable child care. The average annual cost of child care in the United States is $13,128 and exceeds median annual rent payments in many states. Around 134,000 families are pushed into poverty each year solely due to prohibitive child care costs. And the OBBBA expanded the child tax credit eligibility to households with incomes up to $400,000, including those whose income comes from investments rather than wages, while leaving unchanged the provision that limits or denies the credit to parents earning too little money from their jobs. Frag described this as a law where billionaires win and working families lose, and the data supports that description completely. Almost 3/4 of the tax cuts in the OBBBA go to the highest income 20% of households. The top 1% will enjoy a windfall of over $1 trillion over the next decade. The tax provisions benefiting those with incomes over $500,000 will cost the federal government $1.5 trillion, nearly identical to the size of the cuts to SNAP and Medicaid combined. That is the exchange. $1.5 trillion in tax benefits for households earning over $500,000. $1.1 trillion in cuts to food and health care for the poorest 40 million Americans. The math is not a coincidence. It is the mechanism. The cuts fund the tax benefits. The food and health care of the poorest Americans are being transferred to the investment income of the wealthiest Americans through a 1,000-page bill that was voted on at 4 a.m. after last-minute negotiations moved the Medicaid work requirement deadline forward by 2 years. And the children who will go hungry, who will lose coverage for their asthma medication, who will miss pediatric appointments because their parents' Medicaid was terminated over a paperwork failure, did not vote for any of this. They are not old enough to vote. They are not old enough to understand what is happening. They are old enough to be hungry, and a child who is hungry cannot learn. A child who is hungry is more likely to develop behavioral problems, more likely to be hospitalized, more likely to struggle academically, more likely to repeat a grade, and more likely to enter adulthood without the educational foundation needed to escape the poverty that the benefit cuts will deepen. The damage done to a child's development during a period of food insecurity is not temporary. It is measured in lower lifetime earnings, higher lifetime healthcare costs, and reduced economic productivity that persists for decades. The bill signed on July 4, 2025 will produce effects on children born in 2020 that will still be measurable in 2060. Research published by the American Academy of Pediatrics has consistently documented that childhood food insecurity is associated with higher rates of hospitalization, higher rates of chronic disease in adulthood, lower educational attainment, and lower lifetime earnings. The SNAP program was specifically designed to prevent these outcomes. It was not a handout. It was an investment in human capital that returned more than $1.50 in economic activity for every $1 spent according to USDA estimates. Cutting it does not save money. It shifts costs from the federal food assistance budget to the state healthcare budget, the state education budget, the state criminal justice budget, and ultimately to the lifetime productivity of an entire generation of American children. And the bill that cuts their food simultaneously grants $61 billion over the next decade in interest deduction benefits for private equity funds that buy companies using borrowed money, $61 billion for leveraged buyout financing, and $187 billion cut from the food that feeds 16 million children. Those two numbers exist in the same piece of legislation. The states cannot absorb this, and the ones that try will have to gut everything else to do it. Starting in fiscal year 2027, which begins October 1, 2026, states' share of SNAP administrative costs increases from 50% to 75%. That is a 50% increase in the administrative burden on states overnight, and starting in fiscal year 2028, states will begin paying for a portion of SNAP benefits themselves, a cost that has been entirely federal for the 60-year history of the program. FRAX documented that state income tax revenues are projected to fall by $3.7 billion in 2026 alone from the economic impact of the cuts. At the same time that states are being asked to absorb dramatically higher SNAP costs, they are losing billions in tax revenue because the cuts are destroying the jobs and businesses that generated that revenue. The Brookings Institution noted that state policymakers will face decisions this year about whether to cover the cost of the new SNAP requirements, which would require raising state taxes or cutting other programs, or refuse to participate, which would end SNAP in their state entirely. Refuse to participate. That is not hypothetical. That is a real option that state legislatures will consider. The federal government has structured the cuts in a way that gives states a choice between raising taxes on their own residents to maintain a federal program or terminating the program altogether. And in states where the political environment makes tax increases impossible, the math leads to program termination. If even a handful of states terminate SNAP, millions of additional Americans will lose food assistance entirely, not because they are ineligible, but because their state government cannot afford to maintain the program under the new cost-sharing structure. The damage will not be evenly distributed. The Commonwealth Fund documented that the OBBBA was designed to cut funding disproportionately in certain states. The 40 states that expanded Medicaid under the ACA face average cuts of 14.5%, nearly double the 7.9% faced by the 10 states that did not expand. New Mexico is projected to experience the deepest SNAP cut at 43.9%. And New Mexico already has one of the highest food insecurity rates in the country. The states where people are hungriest are being cut the deepest. That is not an oversight. The formula is written into the legislation. And the SNAP benefit reduction happens against the backdrop of a food system that is already under extraordinary stress. Grocery prices have increased 36% since 2014. Egg prices remain elevated from the avian influenza crisis that culled 185 million birds. Coffee is up 19% year over year. Beef is up 15%. The Iran war is pushing energy costs through the food supply chain with Brent crude above $95 per barrel. And the 40 million Americans who depend on SNAP are being told to eat less, with less money, at higher prices during a food inflation crisis, while the tax cuts for the wealthiest Americans are simultaneously adding $4 trillion to the national debt over the next decade. What 40 million Americans are actually about to face in the next 12 months and why nobody in Washington is preparing them. Let me draw the full picture of what the next 12 months look like for a single American who is currently on both SNAP and Medicaid. This is not hypothetical. This is the documented implementation timeline from KFF, AARP, the Commonwealth Fund, and the law itself. In the spring and summer of 2026, this person receives a notice that their Medicaid eligibility will now be reviewed every 6 months instead of annually. They must respond to the notice, gather documentation of their employment or exemption status, and submit it within the deadline or risk termination. In the fall of 2026, if they are a lawfully present immigrant who is not a legal permanent resident, their Medicaid eligibility is eliminated entirely on October 1st, regardless of their work status or how many decades they have paid into the system. In late 2026, their state begins implementing the 80-hour per month work requirement. If they cannot document compliance, their Medicaid is terminated. If they lose Medicaid due to non-compliance, they are barred from receiving subsidized ACA marketplace coverage. They are uninsured with no affordable path to coverage. Simultaneously, their SNAP benefits are being reduced. The standard utility allowances that simplified their eligibility calculation have been eliminated, requiring additional paperwork at every renewal. If they are between 55 and 64, they are now subject to work requirements for SNAP that did not previously apply to their age group. If they cannot document 80 hours of work per month, their food assistance is terminated. If their state cannot afford the increased administrative costs that jump from 50 to 75% in fiscal year 2027, the state may cut the program further or terminate it. And all of this is happening while grocery prices are rising, utility bills are climbing, rent is increasing, gas is above $4, and the Iran war is pushing energy costs through every product in the economy. This person who was already living on the margin before any of these changes is about to lose their health insurance and their food assistance simultaneously during an inflation crisis in a job market that Stanford described as low hire, low fire, with no safety net beneath the safety net because the law specifically designed the fall to have no net at the bottom. And there are 40 million people in this position. Not 40 million theoretical scenarios. 40 million real human beings with real children in real apartments in real communities who are about to discover that the programs they depended on to bridge the gap between what they earn and what it costs to survive have been cut, restructured, and bureaucratically weaponized to exclude them. And the 477,000 healthcare workers who lose their jobs when these patients disappear from the rolls will join them in the wreckage. And the 411,000 workers in retail, construction, and food service who lose their jobs when the economic ripple reaches their industry will join them. And the small grocers who lose 6.7% of their sales within 6 months will join them. And the farmers who lose $24 billion in food purchases over the decade will join them. And the state and local governments that lose $8.8 billion in tax revenue will join them. The 40 million becomes 50 million, becomes 60 million. Becomes every American who lives in a community where the safety net was not just a program, but the economic foundation that kept the grocery store open, the hospital running, the school staffed, and the tax base functioning. When you pull the foundation out, the building does not just sag, it collapses. And the people inside are the last to know because they cannot see the foundation from where they stand. They will feel it when the floor gives way. That is what 40 million Americans are about to feel. And nobody in Washington is preparing them for it because the people who wrote the legislation do not live in the building, and the people who live in the building do not read the legislation. And what happens to the specific communities where the 40 million are concentrated will define the next decade of American life. In Appalachia, where Medicaid expansion covered hundreds of thousands of coal miners and their families, the cuts will close clinics already operating on margins thin enough to be measured in single-digit percentages. In the Mississippi Delta, where SNAP participation rates are among the highest in the nation, the benefit reduction will push millions of calories out of family diets and replace them with cheaper, nutrient-poor alternatives that accelerate diabetes and cardiovascular disease. In the Southwest, where lawfully present immigrants who have worked in agriculture and construction for decades will lose Medicaid on October 1st, the uninsured population will surge in communities already facing physician shortages and emergency room overcrowding. In urban centers from Detroit to Philadelphia to Houston, the combination of reduced SNAP Medicaid losses and 888,000 job losses will compound on top of an existing affordability crisis where 40% of families in New York City already cannot afford their weekly food costs, according to Robin Hood and Columbia University data. The crisis is coming to every region, and the regions where it hits hardest are the regions that were already struggling the most. There is no private sector safety net waiting to absorb 40 million people. There is no charitable infrastructure that can replace $1 trillion in federal spending over a decade. There is no market solution that can feed 16 million children who just lost their food assistance. The only institution that operates at that scale is the federal government, and the federal government just voted to stop doing it. That is why you are watching this, and that is why the next person you share this with needs to watch it too, because the floor is giving away, and the only people who will not be caught in the collapse are the people who saw it coming and moved before it started.